My name is Azreen Owl. I use she, they pronouns, and I currently have the honor of serving as president at the UMD, NAACP at UMD branch. And I'm joined today by my lovely co-host, Janet Kennedy.
Hello, thank you, Azreen. I am Janet Kennedy. I have the pleasure of serving as a councilwoman for the city of Duluth. Today, I am in the capacity of the NAACP, and I have the pleasure of serving as a first vice president and the chair of the Health and Environmental Equity Committee. I am excited to be here. I do want to give a special thanks to the Northland Foundation for the financial support of this COVID-19 initiative. And back to you, Azreen.
I want to give a quick shout out to my amazing board. Together this semester, we've worked on creating multiple events at the University of Minnesota Duluth campus, focusing on solidarity, asking the questions on who is being left out and what we can do to support our community and grow as individuals. As I'm giving a quick shout out, please be sure to check out our Instagram and Facebook pages at NAACP at UMD. We are doing a t-shirt fundraiser, so please be able to check that out and support your local students at University of Minnesota Duluth. The quick shout out to my board is currently the board, we have Vice President as well, Mel, and Second Vice President Eliza, our Secretary Zach, and our Treasurer Jessica. And of course we have an amazing advisor, Teresa Moses, and all of these individuals from different backgrounds, some engineering, some public health, come together to focus on social justice and equity work here in the community. Janet, I will hand it back over to you to talk about your amazing team as well.
Thank you, Azreen. I am excited to be here as well, looking at health disparities. We will be talking about cultural practices during the pandemic. Before we get there, I do want to mention our Duluth branch NAACP and the officers and the amazing work we've been doing. Our president is Stefan Witherspoon, myself as the vice chair and the health chair. Second vice president is Teresa Moses. She also chairs the Young Adult Committee. Our Secretary, Elena Cohen-Bantel, Assistant Secretary and Membership Chair, Mary Cohen-Bantel, Treasurer and Finance Chair, Emily Devrol. Executive Committee members are Cruz Mendoza, Doug Bowen-Bailey, Bob Gritdahl, Kevin Square Brown, Sharon Witherspoon, and Claudia Washington. We also have our Communication Chairs, Ivy Vineo and Becky Nelson. Education Chair, Audrey Devine Eller, Freedom Fund Chair, Andrea Gelb, Community Chair, Salam Witherspoon, and our Political Action Chairs, Princess Kisab and Danny Frank. And we have an Office Administrator, Ruth Cabrera. Also be sure to check out our website at Duluth branch NAACP. There's a lot of information overall about the work we're doing and more specifically around COVID and our COVID actions. Thank you, and back to you, Azreen.
Thank you, Janet. And thank you to our amazing viewers. Just letting you know that if you have any questions or comments, be sure to post them on the Facebook Live that's being streamed. Our team will take those questions and comments and direct them to our amazing panelists. Now, speaking about our panelists, Janet and I will be introducing our panelists before they come up. So our first panelist will be Dr. Ernie Vineo. Dr. Ernie Vineo, MD, is an enrolled member of the Millie Lax Band of Ojibwe and is a board-certified family practice physician. He did his residency at Seattle Indian Health Board and the medical school at UMD Medical School at University of Minnesota Duluth. He is currently on the board of directors for the Association of American Indian Physicians and has been practicing in Indian health for over 23 years. Thank you, Dr. Ernie Vineo, for your service.
And next I will be reading Dr. Simmons Jr.'s bio. Dr. Glenn Simmons Jr. is an assistant professor in immunology and research scientist at the University of Minnesota Medical School. The Simmons Lab works to harness the immune response to improve the effectiveness of cancer treatments. During this COVID-19 pandemic, Dr. Simmons is developing an unbiased mapping technique to track disease prevalence in communities across Minnesota to more accurately determine infection without direct testing. And back to you, Ezreen.
Our next panelist will be Dr. Charity Reynolds, MD. Dr. Charity Reynolds is the medical director for Fond du Lac Band of Ojibwe Health and Human Services Division, and serves both in leadership and in the clinical role as a family physician. She identifies as Mexican American, originally from Arizona, where she did her medical school and residency training at the University of Arizona College of Medicine, where she was involved in rural medicine in small towns and reservations across the state. She also practiced full spectrum rural medicine in Colorado and then moved to Minnesota to serve in the Fond du Lac community. Since the beginning of COVID-19 pandemic, she and her team has been working to develop and implement guidelines and protocols to keep her community safe and healthy despite the persistent disparities faced by Indigenous communities around the world. Thank you, Dr. Reynolds.
And next we have Noklebo Kosi, MEDLPC, which is a licensed practice clinician, I believe, for mental health. Noklebo Kosi originally comes from Johannesburg, South Africa. She is a doctoral candidate in counselor education and supervision program through Capella University. She's a licensed professional mental health counselor and currently works at the University of Minnesota Duluth Health Services. During this unprecedented crisis of this pandemic, Noklebo continues to provide telecounseling, support, and coaching to UMD students. Thank you.
And then we have our panelist, Dr. Verna Thornton, MD. Verna Thornton, MD, recently relocated from Atlanta, Georgia, and is a board certified gynecologist practicing at Community Memorial Hospital in Cloquet, Minnesota. She attended medical school at Morehouse School of Medicine and completed her residency in obstetrics and gynecology at Emory University. She also has 3 decades of healthcare experience caring for underserved women of color in both rural and urban communities. Thank you, Dr. Thornton. And now I will hand it over to my co-host, Janet, to introduce our first speaker.
So really looking forward to having these conversations, and we will spend with the health professionals. The first introduction and the first topic that we'll be looking at is called, What is COVID-19? And we will be asking Dr. Irene Vainio about sharing some basics that we should know about COVID-19 and how we can stay safe. Dr. Vainio.
Bonjour and Dinaway Maganadug. My name is Arnie Vainio, MD. Bonjour is Ojibwe, so I'm Ojibwe. I'm enrolled in the Mille Lacs Band of Ojibwe. And we have 2 greetings that we normally use, Bonjour and Anin. Anin is an everyday greeting, and Bonjour is something you say to somebody you haven't seen for a long time, someone you respect, someone you love, someone you miss. And I do mean to say Bonjour. And the COVID-19, the coronavirus, I think just some basics would be a good place to start. And some of the questions I get is, why can't you use an antibiotic? And there's a difference between a bacteria and a virus. So a bacteria you can use an antibiotic with, and a bacteria is a complete cell, and they're tiny and microscopic, but they have all the machinery to make more bacteria. And so antibiotics can work against those, because you can get one that pushes a hole, it makes a hole in the side of the cell wall, and then water rushes into it and explodes it, and it can mess up their machinery for making more bacteria. And there's different ways to kind of attack those things. A virus is not a complete cell. A virus the biggest virus is smaller than the smallest bacteria. And it doesn't have all the machinery to make more viruses. So what it does is it has to infect a cell and more or less trick that cell into making more virus copies. And that's why it's so hard to beat that. The coronavirus, there's a family of viruses called the coronaviruses, and some of them cause colds, but the COVID-19, the COVID-2 virus is, it's a novel coronavirus, which means that human beings have never seen it before. And what that means is we don't have immunity to it. So with a lot of viruses that have been around that have infected us in the past, we have immunity that's kind of built into us, into some people, not everybody, but there's enough immunity around that it doesn't spread like this one does. This one is a brand new one that we've never seen before, and it can go after anybody. And viruses work in different ways, and this one hasn't been totally figured out yet. Everybody's seen pictures of the coronavirus with those little spiky looking things on it, and its name comes from the crown that's around those things, like coronation. And that virus spreads rapidly between people. It spreads by aerosolized particles. That's why everybody's wearing masks, to try to stop from breathing that out. Asymptomatic people can spread it. And again, that's the reason for a lot of the social distancing and stay-at-home orders, is to try to avoid spreading that. And in a lot of people, in about 81% of people, it causes a relatively mild illness. It's the other 19% that are really more at risk. And some of those will end up in a hospital, some will end up in the intensive care unit, and unfortunately, some of them will die. And we're trying to prevent that from happening. There's huge waves of this coming. And in lots of places, and even here, we're still in the calm before the storm. And that makes it hard. People don't want to social distance. Businesses are having a hard time. Businesses, they're going out of business, a lot of them. And it's hard to see the benefit of social distancing when we're not seeing that much. But if you look at places like Italy and New York and other places where it's really hit hard, it spreads fast, and it's a deadly virus for the people that really get infected with it. So mostly just wanted to give kind of an overview of what it is, what a virus is in general compared to a bacteria, and the fact that this is a novel virus, which means it's new and we've never seen it before. So I think I was allotted 10 minutes to do this, and we got started kind of late, and I think I'll pass it back to Janet and Azreen, and you can have questions later.
Yeah, Dr. Vinio, if you have a couple more minutes, I would like to, if you could get into a little bit about the grocery store etiquette. We haven't done a lot of that. We've done a lot of work around the mask wearing, but maybe some grocery store etiquette and the importance of the social distancing. And if you have a little bit of time, talk about some of the essential workers and what that would look like for yourself and other people, maybe grocery store workers. And I'll pause.
So the grocery store etiquette, keeping distance when you're in there, not buying all the toilet paper. People panic, and in times of panic, that sort of stuff happens. I mean, people begin to hoard things, and somebody else doesn't get it, and so that's one of the big things. And keeping social distance, staying at least 6 feet apart from people, wearing masks. Again, we don't know who has the virus, and we have to wear masks as if we have the virus and we don't want to give it to somebody else. A lot of grocery stores are having, my wife has a 95-year-old grandmother and an 84-year-old grandmother's husband, And he goes to the store at 6 o'clock in the morning, and they'll have special hours for elders, and which is a really good thing to do. People buy up flour. If you've been to the store, you know, trying to buy flour, trying to make bread, yeast on Amazon right now should be, you know, 3 packs for $1.99, and it's $24.99. You know, some places are really gouging people for that. And even with masks, you know, people have the N95 masks and things that should be reserved for first line medical professionals, first responders. And then as far as people that are essential workers, it is healthcare people, but it's also people who do maintenance, that clean things, truck drivers, grocery store workers, bus drivers. There's a lot of people that are considered to be essential workers. And a lot of those people, if you look at janitorial people, a lot of times those are people of color, and those are low paying jobs. And all of a sudden, you know, they're essential workers and they can't stay home. And then illness tends to hit them harder. Health disparities among people in lower socioeconomic classes, there are more health disparities. They don't eat the same good food that we eat. Obesity is more rampant, diabetes, all of those things. And those are the people that get sicker faster, and they're on the front lines making minimum wage, a lot of them. So I think I wandered away from your question a little bit, Janet, and but you know, there's plenty more to talk about.
Thank you, Dr. Vinio. We will move on. Next, we'll have Azreen bring up the next topic. So thank you, and we'll be back.
Actually, Dr. Vinio, I was hoping you would actually also contribute to the next topic we have, kind of using your experience, talking to your experience with the communities you've worked with, but talking about racism, xenophobia, and like culture. So I would like to invite Dr. Glenn Simmons, Jr., and you as well, Dr. Vinio, on, there has been a lot of discussion about disparities, seeing that African American, Latinx, and Indigenous communities are having much higher impact from COVID-19. And I guess my question was, we're also seeing a rise in hate crimes against Asian American communities. And the question was, can you both talk to the way our society is structured, which leads to these unequal outcomes? Dr. Glenn Simmons, Jr., if you want to start that conversation first.
There we go. All right, got it. Yeah, so thanks. Thank you for that question. I think it's really important to try to think about the structure of our society, of our country, in order to understand how the things that are happening right now have come to be. Myself, I study health disparities, and so I've already been kind of in that space myself for quite some time. And one of the things that I learned very early on when I got involved in researching was the idea that historically, the United States and a lot of countries for that matter tend to capitalize off of those who are less financially able. Let's just say that. And if you think about the United States in particular, the relationship between the United States and those of African ancestry, there tends to be a very pervasive, oppressive, and exploitive relationship. And so if you start with the initial arrival of enslaved Africans to the United States, you see in that moment, obviously, exploitation, oppression, and absolute abuse of power and just tyranny against human beings. But then even after the Civil War and there was, the slaves were freed, so to speak, there was still a lot going on. And when we start getting into looking at things like COVID-19, you start seeing a very interesting relationship, not just with government, but also with medical institutions very early on, because the medical field at that time didn't know as much as it does now and relied very heavily on, let's say, access to human bodies, literally human bodies. So, nowadays people talk about, you have cadaver donations to medical schools and things like that. That's a normal thing. Well, back then, there weren't really programs for it. And so brown and black bodies were the ones that they were utilizing, and sometimes by force. So even going to the doctor could easily mean that you might not get treated and your body is now donated for medical research. That is a history that is well established and had been longstanding up until probably the early 20th century, sometime when they actually established laws. But by that time, people were so used to getting them through these illegal ways that it still happened even once there were laws in place. And then you even towards the middle of the 20th century, so 1930s up until 1972, we have the infamous Tuskegee syphilis study, wherein the general thought that was really fueled by racism and white supremacy was that the African or the black person, the African American, was somehow completely physiologically different than a white American, a European American, and therefore we need to observe how diseases manifest in them, but we're not going to treat them. And that's literally what that study entailed. And that happened even though there were ways to treat and cure the sickness. They allowed it to persist. And so when we look at that history in the United States, it becomes really easy to see how people are not willing to take care of their health needs if it relies on a system that has, for generation after generation after generation, has been exploitive and abusive. And then you just kind of wrap that up in the idea that you have historical generational poverty, okay? So generational wealth, there's the opposite, and there's generational poverty, where people do not have the means to say no. So the essential worker aspect that was spoken on by Dr. Vineal a moment ago, you have individuals who don't necessarily make a living wage. They may make enough to pay a few bills, and not being able to go to work is actually very detrimental. And a lot of those individuals are people of color. They are the African Americans. They are the Latinx. They are the Native Americans. And our country has been structured like that since its inception. And so what we're seeing now is just the consequence of hundreds of years of completely upside down power distribution, basically.
Thank you, Dr. Simmons. Would you be able to speak on the rise in hate crimes that are happening in relation to minority communities?
Yeah, so, there's so much to talk about. There's so much to talk about. So we also, American history is full of xenophobia, full of fear of the unknown, for various reasons. And so once the COVID-19 epidemic started to turn up, once it became something that was commonly known, I think as a people, just human beings, tend to want to point to a simple thing to say, this is the reason, this is the cause. And usually the first thing that we do when we're doing that is find something that looks odd. We like patterns. Patterns make us comfortable. Anything that breaks the pattern, we immediately attack. And so that's what we're seeing today when individuals who have an Asian or Southeast Asian background are being victimized, are being persecuted just because they exist, which is, again, is par for the course for American society. It's almost like this is just what we do. We find the odd thing and we kind of attack it as a society. And I think we have to be careful about that, because the exact same thing is actually happening in China right now, where Africans in China are now being victimized and being scapegoated. So it's a very unfortunate human behavior that just keeps replicating. And whatever the initial genesis of that thought is, it's always linked to the idea that people are scared and people want an answer, even when no answer is simple enough to satisfy them.
Thank you, Dr. Glenn Simmons, for talking on that difficult topic. I invite Dr. Vainio, do you have, what can we, well, I guess the question relates to both of you too, but what can we do to like check ourselves and check our privilege and make sure we're not promoting those stereotypes ourselves, or we're not, you know, engaged in discriminatory behavior ourselves. But Dr. Vainio, if you want to talk about like cultural practices in communities too, and how that kind of differs, like positives and negatives, and essentially how do we go about engaging in our ceremonies, churches, and gatherings, and how COVID has affected that? If you want to speak to that, Dr. Vainio.
Yeah, so our ceremonies and churches are the places that we should be able to go for comfort and for answers. And unfortunately, those places right now are our downfall. And, you know, we can't be gathering as large groups of people in ceremony, in churches. And that's difficult for people, because that should be our comfort. You know, we need to look at ourselves as communities of faith, all of us, and our spiritual beliefs can certainly be different, but they're, you know, they're right for us. Ode is the Ojibwe word for heart, and Odena is a community, and what it means is a gathering of hearts. And Martin Luther King Jr. Toward the end of the Montgomery bus boycott, you know, was trying to, you know, bring into being a beloved community of people, Black people, brown people, white people, everybody that respected each other. And, you know, from a traditional standpoint, you know, I've been told by our elders that, you know, we need to respect everyone. And it's difficult to do. You know, each of our communities has its own problems, its own strife, its own history. Certainly Native American people have had smallpox killed hundreds of millions of us. And boarding schools taking away a couple of generations of children from their families, you know, with the intent in destroying a culture, actually turned out to be, it worked like a charm. And a lot of things have been difficult to bring back. And luckily we have traditional people that are doing that. And, you know, we do need to realize this is stressful on everybody, and cut each other a lot of slack. You know, Dr. Simmons said that people have been scapegoated, and that's always happened. And unfortunately, it's always minority communities that happens to. And, you know, we need to see that and realize that's happening to another community. For us, and what we should be doing is using our strength, you know, together. We should be comforting each other. We should be taking care of each other. We should be that Modena, that gathering of hearts that Martin Luther King was looking for.
Thank you so much for that. I love that phrase, gathering of hearts. I resonate with that a lot. Given this year, currently it's Ramadan, and I am unable to go to my mosque and celebrate in community of hearts. But keeping everyone safe is our first priority as community. Dr. Glenn Simmons, do you have anything to add to that conversation?
I think I can't possibly add anything that wasn't already said, but I can echo it with all the enthusiasm that I can muster, because we have to understand that we are all in this together, and no person is an island. The same way that the initial COVID-19 outbreak initiated and many people tried to other it, it's happening over there. We're finding that the world is small and we're all connected, and anything that happens to someone happens to everyone, okay? And I think with Dr. Vainio's statement, that just becomes even more evident. We need to worry about coming together and building each other up and finding our similarities more so than our differences.
Thank you, Dr. Glenn Simmons and Dr. Vainio. I will be handing it over to my co-host Janet to introduce the next topic.
Yes, I am here. Thank you, Drs. Simmons and Dr. Vainio, for your wise words. Next, I have the pleasure of speaking with Dr. Charity Reynolds in Keeping Us Safe. Dr. Reynolds, as a medical director, you're doing a lot of work to help keep communities on the Fond du Lac Reservation safe. Can you share some of what you are working on? Are you able to see other community members, Black, Indigenous, people of color? Maybe also touch on some travel restrictions that you know of and how we can be safe around travel. And then a little bit about testing and what that looks like, where people can maybe get a test. When do you think we'll be able to get testing? I will pause there and let you begin.
Sure. Thank you so much for having me. It's a pleasure to be talking about these important issues. It's important to remember that our Fond du Lac community is very diverse, and many of our members live not only on the reservation, but in Duluth, the Twin Cities, and across the region. Our tribal and health and human services leaders have been very proactive and early on engaged the public health emergency preparedness team. The leaders and this team started learning as much as possible about COVID-19 and how it has affected communities around the world so that we could most effectively protect our own community. We started working with the Indian Health Services, the Minnesota Department of Health, the Mayo Clinic, the state government, and other bands in the state. By the time Minnesota had 10 cases, we put in place travel restrictions. We did employee screenings and public service announcements for our community to reduce the exposure and transmission of COVID-19. The Human Services Division, whose mission is to elevate the health and social well-being of American Indian people, came together to develop plans for the community to continue to provide essential services and prepare for this pandemic. For example, we almost immediately limited all face-to-face clinic visits and started telehealth visits, which was an entirely new enterprise for us. We needed the ability to stay connected with our patients and our community. We started curbside pharmacy pickup. We restricted visitors to our assisted living and our elderly housing. We increased our medication deliveries to those that are homebound, and began systematically calling all of our elders and checking on their welfare and making sure that they understood as much as possible about the pandemic, which we continue to do. We have now implemented curbside testing for symptomatic patients and are working on expanding our testing capabilities so that the needs of our American Indian community doesn't fall through the cracks like it has so often in the past. The reason it is important to get tested when there is concern for COVID-19 is to help identify cases and help reduce its spread in the community. When someone tests positive for COVID-19, it's important for them to stay home and quarantine themselves. Contact tracing is then initiated to find out who may have been affected and then contain that spread. These are some of the strategies that we are using to keep our community safe, and we continue to reevaluate and adapt to this evolving situation. There are plans to help people who cannot isolate themselves in their home due to not having a home or living in a multi-generational home. There are services to provide food and resources for those in need, such as those who have been laid off at this time. We have behavioral health counselors available via telehealth, and we continue to develop new plans in how to serve our community and elevate their health and well-being.
Thank you, Dr. Reynolds. Do you have any suggestions on people and if they're looking to travel? I know we have a stay-at-home order. I'll just pause there and let you
Okay.
give us some information about travel.
So in the health community, we would recommend restricting all travel, and we in the state of Minnesota do have this stay at home, which a lot of states do as well. And the reason for that is anytime that you travel, you're coming into contact with more people, and the more contact you have with more people, the likelihood of you getting infected. And so we would recommend not to be traveling like we used to, not going over to those that are most vulnerable. So our grandparents and our elders, and making sure that we're keeping them safe. So anytime you say, I'm just gonna go travel to the cities, I have something to do, but then you come back and you may have ran into multiple people during that trip, and then you go visit your elder, you could be asymptomatic, so not have symptoms from your encounter in the cities, and then you visit your elder and then they get infected. And like Dr. Vineal said, they're more vulnerable and they could end up in the ICU, or even worse, they can die from COVID-19 that you may have transmitted that you didn't know you transmitted. So we definitely recommend follow the stay at home orders. And there are other things you can do to stay connected. I know a lot of museums are doing virtual visiting museums. You can also teach your elders how to use Skype or Zoom or all these different media to be able to stay connected with them. So it's very difficult, but it's important for us all to stay safe and for our most vulnerable as well.
Thank you, Dr. Reynolds. I know that in my family and in our community, I've been able to help some of our elders get connected through Zoom, and I sat on the phone several hours at one point teaching them how to get on a Zoom call. But it was very important, and this was somebody who had been missing church. And I will just share with my own mother, she's just amazed at the electronic age nowadays and how we can do church and meet with our family. So thank you for all that insight, and I will bring it back to Azreen.
Thank you, Dr. Charity Reynolds, for all of that. It is a very stressful situation for all of us. Being a student at University of Minnesota Duluth, we've had to, all the students have had to adjust leaving, and I mean, we're going into finals week, and that's a different stress of its own. But just coping with all this, a lot of us are saying that this is definitely something that we will be talking about with our grandchildren and how we've lived through this situation, especially being college students. But given that this is a very stressful situation for all of us, Dr. Nonkanbo Kosi, would you be able to share what are some strategies we can use with coping with the uncertainty of this time we're dealing with? Like, what are some coping strategies, other advice that we can use to kind of watch our stress in our daily lives, but also to make sure that we take care of ourselves and heal ourselves during as well?
Absolutely, yes. Thank you, Azreen. Just before I highlight that, the panelists have already highlighted, very important information and how, COVID-19 is actually affecting our communities. And, as I was just listening, the word kept coming out, the phrase social distancing, which of course is what is highly recommended right now. And when we look at our communities, we are social beings. That's just how we are. And, the fact that now we have to social distance, it is very challenging. However, that's what we are expected to do, to protect ourselves and also to protect others. And coming from, I come from a society where I guess maybe most people would relate. We always come from a community, and that's just how it always been. family units, because it's part of our identity or part of our culture. And then now COVID-19 is changing the dynamics of that. And then that is what is creating a lot of uncertainty, a lot of fear, and a lot of anxiety. And as Dr. Venio had mentioned earlier on, like we are dealing with deep fear because we are so uncertain. Thus, we've seen then people react to that fear and buy mountains and mountains of toilet paper because that's a response to the stress. And to tell you the truth, with COVID-19, it is new, and that's why even the response is like this, because no one has ever experienced this, and we are all trying to understand what it's all about. However, for people that are already struggling with depression, anxiety, who are struggling with substance abuse, and other mental health issues, the situation has changed. It has spiked. It is up to the roof when thinking about that. And not only that, look at what the effects have done already. People have lost jobs. So there's already a lot of anxiety and uncertainty, and struggles, financially right now. So the fear is so deep that it is palpable, it's like you feel it even when you walk outside, that it is tense and it is actually affecting our mental well-being. So during this time, in as much as we are struggling, however, I like the fact that we continue to stay in touch. I like the fact that people are beginning to use a lot of technology during this time because of social distancing. So as part of self-care and wellness, in order to combat the isolation, which could cause lots of problems, it would feed a lot into depression and a lot of anxiety. And guess what? Also possibilities of suicidal ideation. So that is why we would encourage people to stay connected with their folks, and for us to reach out to friends, to families, to neighbors, finding a way to call, to text. And I know young people are techno-savvy. They're using all different forms of technology to stay connected. I'm quite aware they've even formed lots of some Zoom parties. I've heard of those, as I'm working with students currently, using telehealth. I hear a lot about Netflix parties where they all watch a movie, although they are, in different spaces, but they are able to watch a certain movie, remotely, and then engage in that. So it's the same thing that we want to encourage even with our communities, getting in touch with the vulnerable, the elderly. And I know there are issues as well, with people who are struggling with substance abuse during this time, because there's more into that. However, I'm hoping they'll be able, to get more support from, I think, in the community, where they would get, telecounseling, just to be able to get by or to cope with stress. And I'm not actually overlooking survivors of domestic violence. When we talk about social isolation during this time, or social distancing, and imagining someone who is in the same space with a perpetrator, what it would look like. That is why I'm saying, if we were to pay attention to our communities and reach out, and knowing, people that may have experienced that, is reaching out, and for them to know that there is support, there are people who are, who are with them and who want to give them whatever support they may need during this time, because there's a lot that is going on and we may not even see it on media, you know. So again, another important thing, in as much as it sounds like with social distancing, we are also encouraging, you know, to stay connected, which takes us back into using social media. If we could try also to limit using it, in other words, getting, you know, even if it's just 30 minutes where your phone is off, the TV is off, your computer is off, and you just disconnect everything and try to rejuvenate yourself. The brain needs a breather so that you could it's more like you recalibrate, you know, so that you could restart, just like when you reboot your computer. So because we are exposed into these, you know, into social media and the news, you know, 24/7, and some news are very distressing, and some news are disturbing, and some news really, you know, you feel like there's no hope, then you can be swallowed easily by that. So 30 minutes of your time and just decompress. And I also want to recognize, you know, some of our community members who may also not even have a space, maybe just to take a breather. I do recognize that there are situations that are like that, even though I would encourage that if people could just have a breather where you are just by yourself. Just by yourself, and feel yourself breathe, or hear yourself think, if it would need you, you know, to take you there. I know we need to keep social distancing, but if you have a chance just to take a walk where you live and avoid, you know, and making sure that you avoid, you know, crowds or groups, just to take some time for yourself again, as part of rejuvenating yourself. And I know with eating, I wanted to talk about that, but sometimes it's kind of challenging because, you know, we all come from different backgrounds. You know, most of the time when stress levels are high, our bodies cringe for sugar. And when you're at home, obviously, you know, you might find that you're just craving for sugar all the time, and that elevates anxiety even then. But it is just watching as well, you know, what we eat. And sleep, getting enough sleep. I may not label what enough means, but I guess for adults, really, maybe 7 hours, or maybe 8 if that's possible. And then another trick is keeping on a routine. The routine, you know, as if you are going to wake up and go to work or go to class or go, you know, and do whatever business you used to do before COVID-19. Because when you keep to a routine, at least it allows, you know, your physical and your mental to be in the present, and it allows you to do the things you want to do. It helps you to recognize your purpose, and then you are able to work on what you want to work on, or, you know, attain whatever goals. And I know for students, they are currently preparing for their exams right now, and you know, the sleep pattern has completely changed because people are always either watching movies or Netflix or doing this and that, and then they lose, you know, their sense of sleep, which would then unfortunately affect the levels of anxiety and also exacerbate depression. So sleeping well is very important. Staying connected, as I've said, is very, very important so that you could also recharge. So you're taking care of your physical and also your mental. I think I'll stop there.
Thank you so much for that. Yes, I love the points that you talked about physical distancing. because although it's social distancing, we are still very connected. So I would, a lot of my folks, friends have started using the term physical distancing instead, because that's what we're doing. We're physically distancing from each other, but we're socially and emotionally still connected. Thank you so much. And please, April is Sexual Assault Awareness Month. If our community members and our viewers watching out there, if you need any sort of help or please be sure to reach out. We do have amazing organizations here in Duluth. I'm thinking of PAVSA. Please reach out and know that you are supported, you're heard, and we believe you, we support you, and we're here. I will give it over to my co-host Janet to introduce the next topic.
Thank you, Ezreen. I am looking forward to this next topic, which is myths, legends, misinformation. We will have Dr. Glenn Simmons Jr. and Dr. Verna Thornton. There are just a couple things we would love to hear from you about the information, maybe some rumors, looking at who really should we be listening to, credentials, where's the information coming from? How does it connect to us? Where do we look? Who do we doubt and who do we trust? I think it's really important to get into how we break some of the myths about COVID. And I will pause and let you go. Could we have Dr. Verna start first? Would that be okay?
Can you hear me now? Thank you for having me. And I'm absolutely thrilled to be here with you all in the greater community. We are disinfecting misinformation. And just those two words alone speak volumes. We are basically getting rid of bad information. And information, when it's misdirected and it's not valid, can cause as much damage sometimes as the actual disease and the virus itself that we're trying so valiantly to eradicate. And so we have to talk about, why do people have distrust of information? When people don't trust authoritative sources, whether it's due to personal experience, religious beliefs, or political affiliation, they become more vulnerable to misinformation, to conspiracy theories, to urban legends, and to old wives' tales. And that can be very, very dangerous. We need to start by talking about the facts of COVID. My colleagues and the other panelists have certainly started and segued into this earlier. But the biggest myth right now is, oh, COVID-19 is just another flu. That is absolutely not true. Dr. Vanio gave you a lot of the structure of the virus, and of course, Dr. Simmons talked about it some, but it is not the same as the average flu. We know through the World Health Organization that regular flu basically is much less virulent, which means it doesn't infect as many people as quickly, and it has much less mortality. We know that COVID-19 basically has a mortality or death rate of about 3 to 4%, compared to the regular influenza or seasonal flu, which the death rate or mortality rate is less than 0.1%. So you look at 4%, less than 0.1%. And it's very important to understand, we have reached the numbers of deaths due to COVID-19 in the United States of America in 6 to 8 weeks. We've reached that number that has been equal to the amount of deaths of seasonal flu in 1 calendar year. So you look at 4 to 6 weeks versus a year. So it is absolutely not the same as the flu. It is important to dispel the myths that, oh, I took a pneumonia vaccine. Certainly I got my flu shot, I'm good. And the answer is no, you're not. Those vaccines do not convey or confer immunity from COVID-19. So again, for all the reasons we've spoken with our other panelists about the need for social distancing, the need to practice personal hygiene to the utmost degree and so forth, those are the reasons we don't have a vaccine. We don't have any FDA approved medicines. We don't have any really recommended treatments. So again, it is not the same. That's one of the myths we need to get out. So let's talk about what is happening in the general population. Approximately, well, the USA, our population is about 4% of the world's population. yet we are currently experiencing about 30% of the world's cases of COVID-19. We also know that Black Americans make up, depending on who you read, about 13 to 14% of the population of the United States of America, yet we account for about 33% of the deaths. Here in Minnesota, there's the Council of Minnesotans of African Heritage, and they're reporting that Minnesotans of African heritage comprise about 6% of the total population here. And we also account for about 14% of the infections and about 6% of the deaths. So people here may be tempted to say, well, only 6% of people of African heritage are dying from COVID-19, but nationwide, it's a little bit higher. Well, we are very, very fortunate here, but it also belies our responsibility that each one reach one and teach one. So while our numbers may not be as high as our sisters and brothers in Chicago, Atlanta, New Orleans, we have the responsibility of joining forces, whether you are a medical person or a lay person, to get rid of myths. Some of the myths we hear is certainly, oh, well, UV light, hydrogen peroxide. We've heard about bleach, ozone, all of those things as being potential cures. None of those things has been researched well or has been found to be in any way, shape, or form helpful, other than maybe topically you can use UV light and hydrogen peroxide and alcohol. But we've also seen an uptick due to missteps in the media that people are taking this for the gospel. And we have had people calling in to poison control. We've had emergency rooms, basically having to respond to misinformation. So again, we need to get out that everything you hear on the TV or the radio or social media is not meant for your digestion. And I do mean that literally, both intellectually or physically. Another myth that we hear is, early on, oh, well, people of color aren't affected because we have melanin. And so people of color extends beyond people of African, heritage. This would be our Latinx brethren. It would be our Asian brethren, our Native American. And you can see the Navajo Nation is, I think, third in per capita rates of COVID-19 transmission. They're people of color with melanin. We've already highlighted what's happening to people of African heritage. And we know the Wuhan city, the area, the province of Wuhan, those are people of color, they're Asian. They certainly had an adverse reaction. So melanin absolutely does not convey any type of protective, effect against COVID-19. As a matter of fact, the first case of COVID-19 on the African continent occurred in Egypt. So again, we need to dispel those myths. And then we sit here, we hear all of these, I call them TV doctors. And I will, on a lighter note, I don't play a doctor. I'm actually a doctor. I have 29 years of clinical experience as an OBGYN. There's nothing more wonderful than taking care of the health of women and delivering their babies and doing surgery and keeping women healthy. So my whole career has been focused, along with everyone on this panel, to the well-being and health of our brethren and our sisters. So, there's really no investment that we have to lie to you, give and convey, bad information. We aren't here to overestimate numbers for some kind of political agenda. We're not here to stoke fears and incite panic. We're here to save your life. And the only way we can save your life is if we can get and gain your understanding and your cooperation with listening to us. So some of our TV doctors, and I'm not going to call names, but certainly, real doctors who are taking care of patients on the front line, we're not here for ratings. We're not here for Emmys. We're here to make sure that at the end of the day, our patients do well, go home healthily, leave the hospital alive. And of course, we want to have a reputable reputation. So, we've seen some of our TV celebrity doctors going on, and they're likening COVID-19 to the deaths from COVID-19, that is, to that of suicides, car accidents, drownings, cigarette smoking, and lung disease. And those are what we call false equivalencies. And so what is a false equivalency? It's basically when you try to compare two disparate or disconnected issues and try to bring them together as one. Suicide is a self-determinate action. It doesn't put at harm the health of healthcare workers. You're deciding to smoke. It's something you've decided to do. It doesn't kill your grandmother, okay? Your unfortunate drowning doesn't have any problems, it doesn't cause any issues with the neighborhood. So again, we really need to basically get rid of a lot of these stereotypes and these myths and start looking for factual information. And I'll leave you with this, one last thought. Fighting COVID-19 it can be likened to a team sport. And you have to make a decision. Do you want to increase your chances of winning by being on a team, in which you're being coached by the best and, who have the dedication to science and medicine and who are here for your well-being? Or do you want to take your chances and go out and hang out and, pursue your personal freedoms and take your chances in the court of public opinion? And the ball is now in your court. We're here to help you. You can choose which team you wish to be on. Thank you.
And Dr. Simmons, would you like to add anything?
Do I have to go? No, I'm kidding. I do have something I want to add. Thank you so much, Dr. Thornton, for that, because you pretty much said everything I wanted to say. So I'll try to find some places for me to add a little spice on top of that. The reality is that we are fighting an information war, okay? And we have to understand how to go about engaging, okay? Now, when we talk about the media, we're not talking about every single media outlet, because there are people out there who are doing due diligence, who are investigating, asking questions, and talking to people who know what they're talking about, okay? Everyone on this panel has several thousand, hundred, maybe 1 million hours of work that we've put in to become qualified in our fields. And so what I want to say, what I want to make sure we open up to the community to say, is that we have to learn how to vet, how to make sure that the information we're getting is safe information, is accurate information. And when we do that, we find ourselves, one, learning more, okay? Don't be scared to learn. But then two, you're able to make sure that you can protect yourself, because sometimes the expert that you may have gotten the information from won't be around. And you're going to have to take your own thought processes and take them to the next logical conclusion. So when we talk about these myths, and most of the myths that I've come across, because as a person of African ancestry, you see, I'm pretty brown. So I engage in that community. And in my previous research, some years ago, I was working on HIV, okay, HIV and AIDS. And so there was a lot of conspiracy and several myths that went around, and they're still going around now. Because for those of you who don't know, AIDS is still a pandemic. It hasn't stopped being a pandemic, just so you know. But the idea that something to do with technology, let's say it, 5G. Nobody said it yet, so 5G is the cause for COVID-19. There is no evidence to substantiate that. Now, as a biologist, I will tell you, I am not saying that any type of radiation doesn't have some kind of effect on a living thing. That's not what I'm saying. I'm saying it does not cause a virus or virus-like symptoms, or the symptoms that are associated with COVID-19 or the flu or any other sickness that's transmitted from person to person. So when we look at this, the technology that's even associated with 5G, which is wireless technology, is essentially an increase in the dynamic range of the frequencies that can be utilized, okay? So it's just a step above 4G, which is still wireless technology, which is a step above 3G, which is still wireless technology. All of these things are non-ionizing radiation. So this is the type of radiation that is not 100% responsible for any discrete sickness. It will not make you sick. X-rays will make you sick. Nuclear fallout will make you sick. Your cell phone will probably make you lose your focus and some sleep, but it won't make you sick. There's no consistent evidence done by researchers and scientists and people who understand the physics and the biology. And I'm going to say that, and I will put my own credentials on the line to have a conversation with anyone who wants to know more about it, because this is not the forum for that. But we understand that there's concerns because we want to understand what's causing this, what's making this so big. Why is it such a big pandemic? Didn't we see it coming? The fact of the matter is that we did. So in 2002, there was a SARS outbreak, and it was very bad. It wasn't really bad in the United States, but it was bad in Toronto, but nobody remembers that. In 2014, there was MERS. It was really bad. These are both coronaviruses, and they happened. And we had very little impact in the United States. So we have to be willing to trace the evidence in order for us to understand what's happening now, okay? And that's with anything. So like Dr. Thornton was talking about, there's a lot of science behind how we live our lives today. The fact that we're having a conversation over the internet, that's science. That was done through a very methodical process, the same process that goes into developing the medicines, that even goes into developing and determining which herbs are going to be healthy for you to take. So like taking elderberry, sea moss, taking a vitamin C tablet. All of those things are largely beneficial for your body. They do not have the ability to kill a virus unless you pour it directly on the virus sitting in a petri dish. In that case, pouring bleach would work as well. But in terms of in your body, all of those things are simply supplements. They help to activate your immune system. In the case of elderberry, it induces a pro-inflammatory state, which activates the immune cells that have them attack anything that's in your body that shouldn't be there. Vitamin C supports the immune system. So supporting the immune system is great. And I recommend you do anything that can support your immune system. Don't overdo it, because anything done too much can be poison. Now, I'm not the physician on the panel, so if I'm speaking out of place, somebody raise their hand. But the reality is that we have no easy solution to this current problem. Now, we're getting close. There are researchers working night and day, myself included, trying to understand, trying to figure out where this thing is going and what it's doing to people who are the most disadvantaged. There are possibly things going on that people don't understand, scientists included. But in terms of the biology and in terms of our understanding of how the human body works, most of the myths, I have yet to find one that is firmly grounded in science, in research, and then is also being delivered by someone who has experience in the field. Before you listen to anyone say anything about anything related to a public health issue, to a pandemic type of issue, check their credentials, check where their information is coming from. Because if at any point what they're saying is not connected to their expertise or the expertise of the person that they're saying told them that thing, the information is probably not valid. And in this day and age, we can find anything. If at some point you can't find out where somebody went to school to study whatever it is they say that they studied, they probably never studied it. And that's the reality. And I've seen it time and time again. Every time there is a major health crisis, there are a lot of people who have a lot to say, but they don't have any credentials to stand on. And unfortunately, there are a lot of intellectual capitalists that are out there. They're really smart people. They talk fast, but they don't have anything substantive to say that, yes, they actually know what they're talking about. And if you ever find yourself uneasy, unwilling to ask the hard questions to figure out what information is valid, you can email me. I'm just telling everybody in the Twin Ports community, if you have a question, ask Dr. Simmons. I am willing to sit down and hash it out, because sometimes that is the process that we don't get the opportunity to go through. because understanding what is being told through all these various outlets is sometimes very difficult. And it's a full-time job by itself. Luckily, that's part of my job. So I'm always doing it. And I'm willing to have that conversation because information is powerful when used properly, but it's very dangerous when it's misused. So connect with people who understand these things, connect to individuals who are willing to connect with the community. And hopefully, we can get through this together.
Oh, thank you, Dr. Simmons. I also know that there is a website called snoops.com that will help you with some references and help you identify any scams. When in doubt, reach out, right? We have Dr. Glenn Simmons here who said we could reach out and give him a call. So, as well as some of our other medical professionals. A lot of the doctors and scientists are more than willing to talk to the public. So thank you, and we'll go to Azreen.
Thank you so much. Now, looking ahead, we talked a lot about what is COVID myths, kind of disparities. Now, what we're looking at going forward, Dr. Reynolds, if you could talk on this, is that we're looking at less restrictions going forward within our country. And then we're also looking at not just having to stay at home. I guess the question is, what are steps that we can take going forward? Going forward as we're maybe leaving our homes, going into the workforce again, or while we're still in our homes, what are things that we can do actively? What would the next steps be? And what can we look forward to, Dr. Reynolds?
Sure, thank you. So we, the Black, Indigenous, and people of color, are the most vulnerable to COVID-19 due to the systemic racial health disparities, social and health inequities. People of color make up a majority of essential jobs, and those that have essential jobs such as cashiers, delivery personnel, and housekeeping are the most at risk due to exposure to multiple people each day. As restrictions are lifted, those that are white and college educated may continue to work from home and avoid interactions and therefore avoid risk. So every interaction is a risk. The virus hasn't gone away. It is immensely important that we continue to follow the public health guidance of being cautious, having good infection control, and being aware of our exposure risk and protect ourselves. We need to continue to be vigilant in washing our hands, wearing our masks in public places, physically distancing ourselves 6 feet or more from others. We need to continue limiting our exposure in public places, such as restaurants and shops. In our workplace, we need to advocate for ourselves and ask to be provided protections such as masks and physical barriers. We may not feel comfortable approaching our employers for fear of losing our jobs, and that way, and in those situations, we should reach out to associations like the National Association for the Advancement of Colored People that have Black, Indigenous, and people of color's best interest in mind. We need to continue to try and prevent from getting COVID-19 as much as possible. In our multi-generational homes of grandmothers, sisters, grandchildren living in the same home, we need to protect the most vulnerable, and that being our elders. Have the elders take the bedroom so that they can isolate when needed. Other steps to take are cleaning high-touch areas around the house, such as doorknobs, light switches, kids' toys. Limit exposure by having only one person go to the store for the family. Have the kids stay home, and making sure everyone in the house are following the precautions. When someone does get COVID-19, in addition to caring for them and helping them recover, the next step is to help prevent others from getting it. So, and that starts in the home, making sure that your loved one who is sick is wearing a mask when around others, that you are taking care of your loved one, that you're washing your hands after doing so, that you are using separate bowls and utensils and not sharing those, staying at home from work and keeping yourself healthy. Everyone should work on being the healthiest they can be by being active, sleeping well, and getting their chronic conditions under control, like their diabetes, their high blood pressure, their heart disease. Now is the time for that. That's the time to eat better, to exercise, to meditate, And these can be difficult in people of Black, Indigenous, and people of color because we're tired, we're overworked, we're constantly going and moving, but remembering that foundation to be healthy ourselves so that we can care for our loved ones. Recommendations from public health will continue to change as we learn more about COVID-19 and learn more about its spread as restrictions are lifted. We may learn that being 9 feet apart is better. So there will be some fine tuning on the public health response on how to stay safe. We're also learning about the disease every day. We now have antibody testings, which may help us to know that someone has had the disease and we think they're likely protected from reinfection, and therefore we can determine who may have immunity. We need to continue to test people and follow that trail of who was exposed with contact tracing in order to quarantine and protect others in our communities. Things are changing, they're evolving. Scientists, doctors, and public health officials are learning how to develop a vaccine, treatments, and how to stop transmission of the disease. But please don't put your guard down. Please don't get frustrated with change. It's change that is leading towards improvements and keeping our communities healthy and safe. Remember to have faith, hope, and to love those around you. We, the Black, Indigenous, and people of color, are resilient, have overcome countless challenges throughout history, and will be surviving and thriving long after COVID-19 is a distant memory.
Thank you so much, Dr. Reynolds. That was such a strong and powerful way to kind of close up our panelists before we turn to our audience questions. Thank you for the looking into future of what we can do to keep ourselves safe and protect ourselves. I do have an audience question for you, Dr. Reynolds. The audience question is from Lisa Johnson. I would like Dr. Reynolds to talk, as she feels comfortable, about how the lack of internet access technology makes things more complicated for rural Indigenous people. I don't think many of us in the dominant culture realize what a barrier this is.
That is a great question and something to point out. So in a lot of reservations, there may not be electricity and there may not be access to media and to television and to the news or the radio. So early on, some places didn't know what was going on with COVID-19 because they weren't getting that information. And other areas I did mention earlier, we've been doing telehealth communications with our patients, which some require them to have a smartphone or a tablet, those kinds of instruments. And many of our patients do not have those capabilities, but a lot of people do have landlines and telephones. So we've been able to connect with them via the telephone. And then for those that don't have telephone or we weren't sure if we were reaching them, we actually printed 5,000 plus letters and mailed those to the households to make them aware of COVID-19, to make them aware that we are here for them, that we are providing essential services for them, to not forget about their health. So it takes the community and the Health and Human Services divisions to remember that, to remember the community and how do we reach them. We're also doing the radio for those that do have radio. Our tribal leaders and our public health figures go on to the radio to reach our elders, those that don't have social networking capabilities.
Thank you so much, Dr. Reynolds. Our next question is for Dr. Glenn Simmons. Are there people of color being reached? Are people of color being reached out and directly invited to participate in clinical trials? If not, treatments may not apply to us. That's what the question says. The individual is anonymous.
Okay. Now, it depends on which trials you're talking about specifically, but that has historically been an issue for numerous different types of conditions, different types of diseases. That's almost always been an issue. Now, even when people of color, and particularly people of African heritage, are reached out to directly, there's that social economic barrier that still exists. Not even getting into the idea of medical mistrust, but just the reality that there are a very high percentage of Black folks in America who are not able to take time off to do the things that are necessary to be enrolled into some of these trials. Because enrolling in a trial is not just the same as filling out a survey. You are offering up your body. Sometimes there are adverse events that would make you have to take off work even beyond what you thought you were going to have to do. I know, for instance, in cases where people are trying to donate bone marrow, okay, to help people who might need a bone marrow transplant, when a person goes through that process and that process like knocks them out for like 2 or 3 weeks, where they're just really feeling sick in the process of doing what they're supposed to be doing, it's a lot. It's a lot to ask for. So when we try to reach out, it's very difficult to say that we're not doing a good job of reaching out, but there's all the systemic issues that also have to be addressed simultaneously in order to improve the outcome of Black people, people of color in general, Native, everyone. Because again, it's not a luxury everybody has, even though it's very important for us to do in order for the drugs that are being developed through clinical trials to be effective.
Actually, that question, apologies, that question came from Kelly Carrington. Thank you so much, Kelly. Our next question, Dr. Glenn Simmons came in during your session, but anyone can answer to this. Where do you see the strength in Black, Indigenous, people of color communities that can be leveraged during these times? And the question is from Chris Devla.
I'll take that one. I think people of color, Indigenous, Black, Latinx, Asian, have been conditioned not to understand and corral our strength and our power. I'm a native of the South, born and raised in Birmingham, Alabama in the civil rights era in the 60s. And I know the advances that we, as people, of African descent, the strides we made when we did come together. And I've always wondered, why is it, what are the barriers to Native, Black, Asian, Latinx joining? And I think, again, it goes back to some of the structural constructs that were devised to keep us apart, to keep us from uniting. And that's why organizations like the NAACP are so important, because tonight we've demonstrated just on an informational level, that we can all come together. We have representation from pretty much every ethnic group other than, we do have Asian. We have someone from the Middle East. So anyway, the bottom line is we have to start looking within our respective organizations and trying to break barriers between our ethnic organizations and join together, not jockeying for power, one group over the other, just realize we're all in this together. And until we can do that, and I don't have all the answers of how we can do it, and I'm sure that was the question, it's coming, not fast enough, but I'm hoping that my children, a younger generation, can certainly make and facilitate these strides, because without it, we're all splinter groups running around chasing our tails, and we're not getting anywhere further than we were, quite frankly, in my opinion, in the 60s and before.
And real quick, I'd like to add on to that. It might be a little presumptive for me to offer up a solution, but one of the things that I see being a very plausible way of helping fix that situation, particularly in the African American community, would be to leverage the community more, because that's one of the things that the Black community as a whole has lost. A lot of things have been outsourced over time to the point where do for self is not something that is a common mentality anymore. And when the first thing that comes to mind to really focus on, if we had to say this one thing, it would be education, because homeschooling is not something that requires a PhD, okay? If you can read, you can homeschool, at least up to a point. And within a community, of individuals, you can find individuals who have different expertise that can take on different subject matter. Because if anyone else remembers, the teacher was only smarter than you because they had the teacher's edition of the textbook. You remember that? So we know that we can do those things. And by having that level of engagement with the community itself, you then are taking ownership of the knowledge base within that community. And so then you're able to move together much more fluidly and change a lot of things just from doing that one thing. I mean, education is the foundation for a lot of the things that we're talking about right now.
And if I could just add to that, you know, it used to be a time, and I guess I'm older than Dr. Simmons, but we certainly respected our elders. And that's something I do see quite a bit in the Native and the Latinx communities. Respecting the knowledge, respecting the traditions, respecting the struggle, respecting, you know, the outlook of their sacrifice for our benefit. And I do see that being whittled away in some of our, you know, I'm not speaking broadly, I'm not going to, you know, attribute anything bad to any particular one group in particular, but I think that we need to start respecting the knowledge of our elders, and we need to start respecting knowledge, period. And this whole venue tonight is about listening to people who have paid the cost to be the boss. And that's not in an arrogant sense. It's in the sense that we're giving of our time because we really are interested in helping our communities. And we really would like for, you know, everyone listening and viewing this to give the amount of respect due to everyone with knowledge, not just in this field about our topic on COVID-19. That's how we as communities of color come together. When we respect one another, we join one another, and we basically build on each other's knowledge and experiences.
Before I move on, Dr. Glenn Simmons and Dr. Verna Thornton, if you want to say one last thing, just one phrase. So think 15 seconds to say your goodbye to the audience.
I would just say thank you for having me. I'm proud to be a member of the Duluth branch of the NAACP. I'm proud of everything we're doing, and I hope this has been of service to the listening and viewing audience. Thank you.
The last thing I'd like to say is, again, thank you for having me. But to the community as a whole, I would like to say, do not allow yourself to be separated. Do not allow yourself to be isolated. Again, physical distancing, not truly social distancing, and especially from those who may have expertise in different fields. And email me if you have questions. I'm Googleable, all right?
Thank you, Dr. Glenn Simmons, and thank you, Dr. Verna Thornton. Dr. Charity Reynolds, do you have any final advice for our audience?
Thank you. I want to say that everyone should remember that we're going to get through this, that it's important to take care of your health so that you can take care of your loved ones, to decrease that anxiety and that fear that it's going to be okay, and to reach out. Like everyone has said, please reach out to us. We are here for you. We're here for the community. We're here for anything. So if you have any questions, concerns, we will find you the resources that you need. So please reach out to us. Be well.
Thank you, Dr. Charity Reynolds. Nokembo, I apologize for butchering your name again. Would you like to say some final words and any advice you can have for our audience and viewers at home?
All right, thank you. Firstly, I just want to say I am humbled that I participated with this panelist and just to hear more, and just to learn, because learning never stops. And to our communities, really, I would just encourage us, or all of us, really, just to be together. I think this is just teaching us something here, just to take a moment and realize that we are in this together and we can pull through together. So let's stay in touch and support one another. Thank you.
Thank you so much, Nokembo Kosi. And now, Dr. Ernie Vainio, if you have some last wisdom for our viewers at home and the audience members, we would love your kind words.
Yeah, so the first thing I would like to say is a fun fact, that molecules are either hydrophilic or hydrophobic. Hydrophilic means they love water. Hydrophobic means they repel water. The coronavirus has an oily membrane around the outside of it, and it repels water. And one of the things, so soap, just regular old soap, is amphiphobic, so, or amphiphilic. So it loves the tail end of the molecule. One end of the molecule loves water. The other end loves oil. And soap, when you just use regular old soap, it gets into the membrane of the coronavirus and it just rips it apart. 20 seconds, 2 rounds of happy birthday, whatever, yellow submarine, whatever you sing, that's magic. And it's just regular old cheap old soap, nothing fancy about it. And then the other thing is, one of our elders that I really respect, Native people go on a fast sometimes, and it's a time when you're alone with your thoughts and maybe not eating much, not drinking much, and you find the answers within yourself. And this is a time for that now, when people are distant from each other and they're isolated. You know, we were born with the answers inside of us, and we forget those things, and we wander away from it. And those things are there. We have that inside of us, and people are stronger than you think. And one word I would close with is Zungadeewin, and that means courage. And courage means courage means to do the right thing, even if the consequences are unpleasant. It means to do the right thing, even when you're afraid.
Thank you so much for all of that. I'm so honored to have been here with all of you. It's amazing as an Asian woman, Bengali Asian woman, to see, be kind of in a presence of Black, Indigenous, people of color mentors in the community. We have Asian, Black heritage, Latinx, and Indigenous individuals here today. And so I'm so honored to have been with all of you. Thank you so much to all of our panelists who have been present here with us. And thank you to my amazing co-host. The audience had, throughout the comments in the audience, besides their questions, they've all been saying kind words to all of you and are very excited to see all of you. And quite frequent of, my team says that quite a lot of them say hi to all of you. So thank you so much. Janet, do you have any
Yes, I am here. Thank you, Azreen. It's been a pleasure to co-host this with you. I want to thank all the professionals and how we're able to come together. It's really important in how we can make a difference. Before I say my last words, I just want folks to know that we have your questions, and we will have on the website of the NAACP, and I can't speak for the UMD, but we will have the contact information of all the professionals here. One of the things I want to say is that a community will only survive and prosper as a whole when we're all walking on even ground. That's to say that we need to think about that every day, but more importantly during the COVID. So thank you all.
Thank you so much, Janet. It's been an honor to work with you. If our viewers at home have any other questions, be sure to go onto our websites and contact our health professionals here today. If you want to also leave a question in the event page on Facebook, feel free to do that as well. Be sure to get in contact if you need anything. And we all hope that all of you stays healthy as you can be during this stressful time, and safe. Please reach out if you need anything. Thank you so much for joining us today at Disinfecting Misinformation. I hope we disinfected quite a bit of misinformation for all of you. Thank you so much. Goodbye.